Hello, this is Dr. Gay from First Look MRI, and this is a 40-year-old male with complaints of shoulder pain. He does work out and it has impingement type symptoms according to the orthopedic surgeon. So they are looking for rotator cuff pathology. The rotator cuff itself looks pretty good. This is the supraspinatus muscle, tendon going underneath here, attaching out on the outside of the round ball here, the humeral head. This is called the greater tuberosity here. And the muscle thins to the tendon, attaches here. The signal is a little gray. There may be some mild tendinosis, but there's no full thickness tear. But the patient does have two other findings. One of them is above the shoulder joint. This is the shoulder joint, the glenohumeral joint, and superior to that we have another joint called the acromioclavicular joint. This is the clavicle here. This is the acromion here, and where they come together is the AC joint. This AC joint is diffusely abnormal. It's gray and enlarged. You can see it pokes downwards and pushes on this supraspinatus right at the musculotendinous junction. Here's the muscle, tendon, and it's right there. The distal muscle fibers are getting pushed down, and this definitely could cause impingement. But also there's dark signal there. This is a T1 weighted image. We should see fat as bright. Instead we see everything as dark. So we know there's lots of edema within that bone. We'll look on this view to confirm. This is a protein density fat suppressed sequence, and we see the bright signal. The signal should look more like this, dark. Instead we see this really bright signal within the acromion and clavicle. So this is a case of erosion at that AC joint and prominent reactive marrow edema, and also the spurring that's pushing down on the rotator cuff underneath it. And I used to call this AC osteolysis because on plain films it would be bone resorption because of the chronic marrow edema, and it would look lucent. Now we just call it severe degenerative arthropathy, which may be related to repetitive motion at that AC joint. A little darkness here, maybe some vacuum phenomena right there. So that's one of the main findings. There's one other finding which is down below. There's a little fluid collection down here. This is a paralabral cyst. The patient also has a tear of their inferior labrum. So the labrum is this little dark band that goes around the rim of the cup. We have the round ball, humeral head, sits in the cup and rotates. And around the rim of the cup there's a little black wedge. Looks like a meniscus, a little fibrocartilaginous band. Goes like a ring around the rim, and the inferior part of the rim has a little vertical tear. You can see the little white line there, and also coming out of that tear is a fluid collection. We call this a paralabral cyst. And sometimes the labral tear itself can be hard to see, but when you see the cyst, you know there must be a labral tear there someplace. So AC osteolysis or severe arthropathy, and this is probably the main source of their pain, and then this paralabral, inferior labral tear and paralabral cyst are not helping anything. And the rotator cuff looks actually very good, and that's it. Thank you very much.